Good evening, everyone, all the young people joining this Youth Against TB Awareness and Action webinar. I am Rishi Banshiwal from Health Volunteers, and today we have Dr. Rakesh from the Union. He is the Deputy Director of the Union. I have had the privilege of working along with him on the I Defeat TB program, and it's been a pleasure knowing him and learning from him. He is one of our mentors who's keep on guiding us on how to lead youth related programs and also TB related programs in India and also globally. We are today talking about what is the role of young people volunteering on TB. And in this session, we would like to also learn from all of you young people who are already volunteering in this sphere, who are doing groundwork, and who are also spreading awareness and advocacy around this topic. And we have the expert on tuberculosis. He'll be talking mostly about tuberculosis, what is the role of a young person in leading it. And I'll also talk about volunteering in a gist. And I am handing over to Dr. Rakesh to take us through this session. Thank you once again, Dr. Rakesh.
Very happy to interact with all the youths who have joined from across India and Nepal from other places. Very happy to interact with all of you. It's always a pleasure. It's always a pleasure to be with youth. I know many of the faces are very familiar. I have seen Sadiksha has opened the video now. So very happy to interact with you and very excited about the kind of activities that you are doing as a group. Youth is a period where full of energy, full of enthusiasm, full of creativity. So that is essentially that we really need to solve problems around us. TB is one such problem. Basically, if you look at, we know, TB bacilli is there with us for millions of years now. So there are, if you look at the story of TB, generally it is there with us for millions and millions of years now with us. At the same time, what we are actually looking at is still, even after these many years, still if you look at the infectious diseases causing maximum number of deaths across the globe, the single leading cause of infectious diseases causing maximum number of deaths across the globe, it's TB. Over the years, it's TB. Only in 2 years, during the COVID pandemic era, the COVID deaths were more than TB. But still, again, if you look at the last year, TB has caused maximum number of deaths across the globe. When I say the numbers are in, say, for example, huge numbers, but again, every number, there is a face behind every number, actually, if you look at. Any person who is dying of TB. So just to tell a story that in India, if you simply look at, every hour there are around 40 people dying due to TB. I'm repeating it again. Every hour, 40 people are dying in our country, in India, due to tuberculosis, right? So that's not a small number of deaths that are happening. So that means every 2 minutes, there may be, say, or every 3 minutes, there may be 2 people dying because of TB. We started this conversation, now it's the 6th minute I am talking, 2 people have already died in India because of TB. Similarly, we can do the same results. Nepal is also not different because size is small, but I'm just giving you the examples in terms of depth and gravity. It's an infectious diseases. It has a good treatment, very easy forms of treatment. There are tools to detect tuberculosis, but still why people are actually dying due to TB? This is something which is actually worrying us. See, for example, if you are not having anything, if you don't have a treatment, if you don't have a test to diagnose, that's fine. Yeah, but still there might be a long way to go. But with all these things with us, why people are still, this much people are dying due to TB across the globe. The story is not different. The India story is same as Nepal story. It's same as any other developing countries. If you look at Indonesia or Pakistan or Bangladesh, whatever we are actually look at, the story is same. It's not a causing so much of deaths, basically, if you look at, and most of the deaths are in the productive age group. Say, for example, between, say, 15 to 45 years of males or females. Say, it's more among males generally. But that's among the productive age group that affects the productivity of the nation or the society generally, right? It's not only that's what I generally not consider TB as a medical problem. It's basically a developmental problem. Say, for example, it has economic impacts. because most of them are breadwinners of the family. They won't be able to do their productive work because once affected with TB, maybe for months they may not be able to work properly. So what happens is basically they won't be able to earn. That affects the family's income. That's on one end, but at the same time that actually affects the productivity of the nation also, or the productivity of the society also, because it's the workforce that is getting affected when breadwinner of the family is affected and maybe succumb to deaths. This is again a disease that is causing children, many children orphaned, out of schools, all these things. So that's what it is being interconnected with other social issues also, right? So especially the stigma attached to it, especially the discrimination attached to these infectious diseases. So many people, what happens with TB is again there are so many social issues that are actually being associated with TB. So there is an economic issues, there are social issues, there are medical issues. Altogether, it is a developmental issue. The TB hinders the progress of any society. Or in the other way, it is being used like this. Say, for example, developed nations or nations with huge progress, the TB is coming down there automatically. So TB is basically an indicator of the nation's progress. It hinders the progress, and it is basically can be used as an indicator of the nation's progress generally. So that's why it is being part of a ending TB is a part of sustainable development goals basically. So it's part of a sustainable development goals. So as youths, this is basically the case that I am actually presenting to you. I am not opening my presentation. Generally, I have a presentation also with me, but I don't want to open that. I would love to hear more from the youths and more energetic works that are actually you are actually trying to do. The case that I am trying to build is it's a developmental issue. It affects the progress of the nation, but it's very easy to deal with also. Say, for example, we have a good number of tests, we have a good number of treatment. It's almost sure that we can treat anybody if we diagnose them early. Early diagnosis is the key to any in order to end this problem, no? Because this is being transmitted through air. This is an airborne disease. If you generally look at, if I have TB, it can affect in any of my organs, but most important organs affected is the lungs, my lungs. Right. I may develop symptoms associated with respiratory diseases. Like, for example, I may develop cough. Right. So when I have TB, it's a bacilli. The bacilli is there in my lungs. And what will generally happen is when I cough or speak or sing, whatever it is happening, the bacilli will come out basically. The bacilli will actually come out of me. Once the bacilli is coming out of me, I can spread this to the other people who are inhaling the same air. So we know that the bacilli will never respect, or the air will never respect any boundaries or anything. That's why it's basically a global problem also. Like TB in one place, that also means TB everywhere because it's spread through, it's an airborne disease generally, like what is being happening. So that's what we need to think about it. If we diagnose them early, that is the biggest prevention for the society, right? The biggest TB prevention for the society is basically right. We diagnose everybody, all people with TB early. If we diagnose them early, we can prevent the spread of TB in the community generally. So in that way, we can actually try and control or the end the TB or reduce the incidence of TB or reduce the burden of TB or cut the transmission of TB in the community. Early case finding is something which generally we really need to do. So why early case finding is not happening? Do we have good tools? Yes, we have good number of tests available with us where if we test a biological specimen like a sputum sample, like when we cough out and we get a sputum, if we test that, now we have the test within 2 hours, we'll get the results. It will tell you whether you have TB or not. So such tests are available. It is being decently deployed across. But only thing is somebody needs to go and test that. Right? That's something which we really need to do that. There are other tests that are also available, I'm generally saying, but all these tests are generally available free of cost in the government sector. These kind of tests are available in the private sector also. Who needs to go and check? Again, it's a big story, but again, typical symptoms are basically it could be cough, fever, weight loss, or blood in sputum. All these are long lasting symptoms. Say, for example, if the symptoms last for more than 2 weeks, definitely, yes, we may need to investigate for tuberculosis. Apart from this, there are few groups of people who are at higher risk of developing tuberculosis. Obviously, as anybody living in a high burden setting are living in higher risk. but say people with diabetes, or people who are smokers, people who use alcohol, or people who are immunocompromised, or people who are elderly, people living in orphanages, old age homes, destitute homes. These are the kind of people whom the chance of getting a TB is more. Doesn't mean that nobody else can get that disease. The first slide which I would have shown in the presentation is basically I would have shown the pictures of few people. Say for example Nelson Mandela, or S. Ramanujan, or Kamala Nehru, or Amitabh Bachchan, or Muhammad Ali Jinnah. And would I ask you what is common among all of them? The common among all of them is they all had TB during their lifetime. So that means TB is a disease that can affect anybody. Anybody sharing the airspace, we can get affected with tuberculosis. So most important role of youth would be basically helping in the early diagnosis of tuberculosis for the progress of the nation. So anybody we may need to promote getting them into diagnose tuberculosis early. We also need to be aware about where these tests are available. We'll take that things during the discussion time. The other important thing is once a person is diagnosed with TB, I already mentioned that treatment is going to be for minimum of 6 months. Treatment is going to be for minimum of 6 months. So during that time, so to take the drugs for 6 months, it's not an easy task for anybody, right? So if the doctor prescribes antibiotic course for 5 days, I'm sure that by the third day we will try to stop, say that we are feeling better, so we don't need to take it further. But that's not the case. But for in related to TB, people will start feeling better by the end of 1 month or 2 months. There is a chance that they may stop the treatment. But the problem is the bacilli may re-emerge again later with a drug resistance strain later. So we need to ensure that they complete the treatment for the entire 6 months. Completing the treatment for entire 6 months requires motivation, that needs support, that need counseling, that may need any sorts of supports, basically beyond what we generally think like. So they may need nutritional support, they may need emotional support, they may need counseling support, or they may need somebody to accompany them to the hospital. They may need somebody to motivate them and say that please take this drug today, you will be all right after some time. So that kind of support is essentially required for completing the treatment. So early diagnosis, complete treatment, these are the keys for which we are actually looking at for ending this problem or ending this problem in the society. uh, Lots of stigma, you all know about that. The topic today is also about the stigma sort of stuff. Why generally there is a stigma? Mostly because of the lack of awareness. So that is something which we really need to uh, discuss about. We have a major role in fighting against stigma generally, right? And spreading the awareness generally throughout in the community, right? I will just stop my monotonous dialogues here, and I will like to hand over to Rishi or the other youth leaders here. I would like to listen to you, address your queries, and discuss with you further. I will stop here for the time being, Rishi.
Thank you, Dr. Rakesh. And I guess a lot of young people who have already volunteered in the TB sphere or maybe in general have joined us. So maybe I would like to ask, what is the best and consistent way of volunteering
Okay.
against stigma on TB?
Okay, so first thing that we need to understand is about why this stigma is there in the community, right? So if you look at the historical perspectives of tuberculosis and all, so initially when a person is having TB during that old era, like if you look at the previous eras, the only treatment available during that time was basically uh, there was no drugs actually available for treatment of TB. They need to take good food or good nutrition and good ventilation. And what we used to do previously was like we used to isolate people. So isolation means we will take people away from coming in contact with the general community, and we will build something called sanatorium. Sanatorium is basically a place where people will be
Dr. Rakesh, can you unmute here?
have you heard something? No, you have not heard anything.
We were not able to hear anything after uh, ventilation.
Okay, so I'm saying, previously, then what used to happen was like we used to isolate people with tuberculosis. Isolation basically means we used to take them to a hospital or a sanatorium where they will be provided with good ventilation and good food. There was no treatment other than that. Isolation was basically because this was an airborne disease at that time, and people without much treatment continuing to stay in the community will keep on spreading the disease to others. So this was the old era of treatment, and the entire thing of stigma stems from this actually. Say for example, isolation itself is, you know that during COVID time, quarantine itself was basically an issue, right? So nobody wants to go to quarantine, and we may feel that okay, fine, isolation. If we have COVID, then we need to remain isolated from everybody. We should not come in contact with anybody. So these are all generally stigma creating. There may be self stigma also, but these are all generally this is a person to be isolated. That's something that thought will actually create lots of stigma. Honestly speaking. That also stems from the feeling that I will never get TB. That's again a wrong perception, right? Anybody can get tuberculosis. That's what I'm trying to say. Anybody can develop tuberculosis, depends on their immunity living this world. Because if you're breathing the air, because air is not compartmentalized, right? So that means anybody can develop tuberculosis. Think of the COVID, the same thing that we are actually talking about with related to TB also. There are different subtle differences, but I will come to that. Now, what is basically happening is we have a strong, good treatment for tuberculosis. We have a good anti-tuberculosis treatment that is being available. The moment we diagnose and put a person on treatment, the moment he or she starts taking the second pill, the second day of the pill, the infectivity comes down drastically. The infectivity means the ability to spread the disease comes down very drastically, right? The moment we take till we reach the 2 weeks of treatment, the infectivity is absolutely nil. Absolutely nil. So then we don't need to worry too much about their transmission, their spreading capacity, or anything in that way, right? So that's what I'm trying to say. There is no need to worry about transmissions further, because once a person is diagnosed, the moment we put them on treatment, their infectivity is coming down drastically, right? This is what is going to happen. Now, see, if you are think that if a person is not getting diagnosis at all, just think in this way: the person is not getting a diagnosis at all. What is going to happen? The person will be happily living in the community, staying around us. They will be keep on spreading the diseases to everybody. There is no stigma, and we are not worried about that also, right? That's a dangerous phenomenon, right? Think about it, right? So what happens generally is the person with TB is there. I will try to move away from that person. I am moving away. But there will be four people undiagnosed TB standing on my back and coughing. You understand that? That's basically a bit of it's not going to solve the problem. It's not going to take us anywhere, right? So it's not the running away that is actually required as far as TB is concerned. It's basically about sensible knowledge, understand about what is going to happen to the TB, and support them, because it can happen to anybody and they need support. The person with TB now is not me or not my father or not my brother or not my sister. Okay, I understand that. But that person is somebody else's father or mother or brother or sister, right? And it could be our father, mother, brother, or sister tomorrow, right? Or even it could be ourselves, right? I mentioned that. Amitabh Bachchan got TB. Nelson Mandela got TB, right? I'm just mentioning. Kamala Nehru had TB. Muhammad Ali Jinnah had TB. So that means it can affect anybody, right? That's possible. So we just need to realize that it's not the running away that is actually required, but consciously, judiciously face that issue is that what generally we need. So that's basically we need to spread things in the community, diagnose them early, putting them on treatment. That is the best way that we can actually try to solve this problem, rather than having the stigma, rather than having running away from the problem. That's not going to help us anyway. If everybody decides to run away, you will be never be able to solve the problem, and you will be landing up in more and more troubles. Because you are traveling in public transports, you are going to movie theaters, you are watching. You are going to malls, you are going to hospitals. So it's there everywhere. It's there everywhere. That's what I'm trying to say. Just to tell an example, in India, if you look at the number of people who are developing TB disease in a year is estimated to be around, say, 28 lakhs. It's in lakhs. So it's there everywhere. 1 year, I'm just saying. We have 28 lakhs people are developing TB in a year. So it's there everywhere. If you take every 1,000 or 100 lakh individuals, maybe around 300 will have TB among them. So it's there everywhere. And I am sure that in everybody's family, you had some forms of TB in your childhood, or anybody will have some forms of TB. It's such a common problem. So there is no point in running away, but let's face it, let's address it, raise the awareness in the community, say that I am willing to fight against TB because it's a medico-social, environmental, economical development developmental issue. So it's my responsibility to fight against TB. It's very we have a good treatment, we have a good diagnostic test that's available, and we'll be able to bring the people and the families back to normal uh, very easily. We can transform lives, we can change lives actually easily through TB. This is something which I would love to say about that, Rishi. Maybe we would love to hear from others and other concerns generally.
We have one question about MDR-TB from Sakshi. She
Yeah,
has asked for her own case
yeah.
uh, that she has MDR-TB, which caused vertebral fracture, and now she is suffering from peripheral neuropathy. She wanted to ask, like, are these symptoms temporary or will they stop after medication?
Right, Sakshi, this individual questions, I mean, I'm generally not trying to take it in the public forum, but generally, what we need to understand is one is TB can affect any organs in the body. Very rarely such diseases are there, right? TB can affect any organ in the body. Uh, um, except hair and nails. This is what I generally try to say. There are forms of TB affecting the bones. There are TB affecting the lymph nodes. There are TB which can affect the eye. There are TB that can affect the abdomen. There are TB which can affect the skeleton system. Anywhere, everywhere, TB can affect any organs in the body. That's called specifically called extrapulmonary tuberculosis. And these anti-TB drugs are also basically will have some, they can cause some adverse effects. There is no doubt about that. But say, for example, anything under the sun that can actually cause uh, some effect will have some adverse effects. That's okay. I mean, very rarely it can cause some adverse effects. But generally, how the modern medicine works is it looks at what are the benefits that we are going to get out of that and what are the adverse events that are going to face. Only when the benefits clearly outweighs the adverse events, a drug is available in the market generally. And there are adverse events. Peripheral neuropathy is one such adverse event. Could be one such adverse event. There will be reliefs when we complete the treatment. There are also additional drugs that you can actually take to further prevent worsening the problems. I suggest you consult with your treating doctor, explain to them. They will guide you in doing that. If not, please feel free to get in touch with me generally. I'll stop here.
Great. Thank you so much, Dr. Rakesh. Now, I would like to talk a little bit about volunteering and community engagement. I'll be mostly talking how and why young people matters in this youth engagement for TB. As we all know that young people bring a lot of energy, innovation, and extensive social networks. So young people's role has a lot of potential to create a multiplier effect. That's why bringing young people to volunteer for tuberculosis is very important. And they themselves are also facing the effects of TB. And there are a lot of high burden among young people in South Asia and Africa. And transmission rate in young people is also very high. According to a report, 20 times more faster spread is there, which is seen in young people. And challenges which are faced by young people is that they are lacking a lot of awareness. And again, stigma is affecting all of us, including them. So, youth engagement for tuberculosis is very important. And what is volunteering? If we see that we all are contributing our time and skills to fight against this disease, as we all did even during the COVID time, we worked to fight the myths, misinformation, support our communities, families, and all. Even for TB, we should follow the same tactics and same strategies. And including young people in these strategies is very impactful, and not just for the community, even for young people themselves and the state and nation or globally altogether. What are the key roles that TB volunteers can take and what they can do? Simply, there are so many simple things which we can start and act from now onwards. First of all, I simply say that first we all need to learn what is TB, how it spreads, all the information related to TB, all the right information related to TB, so that we can aware and educate other people, whether it's about TB symptoms, how it is transmitting, how and where from they can take the treatment. As Dr. Rakesh also mentioned, there is a high burden, and understanding about TB knowledge is very important. We can act as peer educators. We can support patients who are ongoing the treatment, or maybe we can motivate some patients to go and get diagnosed. So all of these roles we can play. One of the most simplest but yet most important area that we can work on is stigma reduction. So first, understanding all about tuberculosis and how we can fight against it as a community of people, of young people who have the potential to act as advocates, as knowledge replicators and all. We have so many methods. We can do utilize social media campaigns, pledges, street plays, and all, these days a lot of chatbots and all things are there. So we know how to use them and we can utilize them to spread awareness. Our role can also be identified at places like how we can actively find more cases of TB. As Dr. Rakesh said, that TB is already there among so many people. People are going through tuberculosis as a disease, but many people are also not aware that they have tuberculosis. They are just going through those symptoms. So we can help in active case findings, and we can support. And again, awareness and education will play a very important role here. If we know what are the signs and symptoms of TB, then we can go for treatment also, and care also, and diagnosis also. These days, young people's role in digital advocacy is very important. So that's what we want to focus on also as health volunteers, that how we can promote community mobilization and engagement using all these digital advocacy platforms and tools that we have. And those of you who have joined our campaign might be already utilizing the course and the tools that we have set for you. Another thing, that you can join your nearest NGOs or health workers to support them in amplifying their impacts. A few benefits that I would like to talk about while volunteering, and especially about TB volunteering, is that whoever is volunteering as individuals, we can focus on improving our skills, whether they are communication skills, leadership, technical. We will be able to improve civic engagement. We will be able to create social support, that we are able to create more friendships, more mentorships when we are volunteering. This also can help us in our own personal growth. We will be able to understand and empathize with the people, with the community, with the patients. And this will also help us in, gaining our own confidence and even impart the confidence to other people. And I have seen so many times volunteers who are actively engaging on campaigns, on programs. They are like developing their skills, they are improving their civic engagement, but also all these things are culminating for their career advancements. I'm pretty sure that whenever you are volunteering, you are also getting recognitions, rewards, and acknowledgements for all your efforts. Those things are helping all of us, even for young people. All those certificates, acknowledgements, that kind of experience is helping us in our career also. So the basic question is, why not to volunteer then? We have the win-wins. What are the benefits for the communities? If you see, if we are volunteering in the community as a whole will gain the knowledge. So there will be increased awareness among the community. So suppose if only one person knows about the knowledge, the whole community is able to understand. And as a community, we will be able to impart that and support each other. There will be less stigma when we all have the awareness and education around this disease. Improvement in treatment and adherence will be there, because we will be supporting each other and there will be no stigma. Communities in general will be healthier if we all are volunteering for TB, and there will be more inspired civic engagement, more and more young people, and even volunteers from each and every age group will be able to join. How volunteering helps a state or a nation is that we are able to create future leaderships. Volunteers who are working today are the leaders of tomorrow, because, as I said, individually they are gaining a lot of skills, a lot of knowledge, and a lot of information. Even to the state or nation, there are so many economic benefits. When there is less TB in the state or maybe in the nation, there will be less burden on the health system, less economic losses, and a lot of opportunities, less time spent on getting recovered. If I, as a person, is getting TB and I am spending 6 months getting the recovery phase, so I am not able to utilize my potential. So even social capital and partnerships, we can build strong partnerships among authorities and communities. All strength health system will be strengthened There will be cost savings and improved surveillance and accountability. Volunteers can play a very important role in surveillance. uh, Next is how, as a global community, volunteering can help. Ultimately, volunteering is related to SDG goal number three. Sorry, TB is under goal number three. So whatever work we are doing, it's giving more power to that. Advocacy impact helps global community. More and more focus gets on the TB disease, and more investment and acknowledgement goes there. Volunteering as a tool in itself is a very powerful tool. So if countries and global communities are utilizing it, a good, powerful community and civic engagement can be seen. Health security will be there, cross-border solidarity will be there, and leadership to promote global public health would be there. Strong policies will come through all of it. Now, this is the most important table that I have curated for all of us, that we as volunteers also face a lot of challenges. Like, I can ask anyone to volunteer, but most of you can also tell me, like, okay, I am not able to volunteer because of certain reasons. I have here the challenges, and I also have here the solutions that we can think about. So basically, one of the challenges that we fear, that we see, is that stigma and fear of TB. We as volunteers, if we are going on the fields and working on tuberculosis, so there are stigmas and even the fear that can we also get TB. Maybe Dr. Rakesh will be also able to tell more about this, but simple solutions to that also exist. So we can focus on simpler acts as volunteers according to our competencies. If we are not having enough knowledge, then we can focus on improving our knowledge. We can focus on improving the right tools that we can use to fight against TB. There are safety concerns, so we can focus on how we can protect ourselves first using masks, sanitizers, and other safety protocols. There are time constraints and low motivation of volunteers also. So we can see, maybe as designers also of volunteering programs, how we can promote flexibility, how we can recognize more and more young people, and how we can make it more engaging. Many a times, young people do not also know what to start from, or what to, or how to volunteer at all. So if you guys are starting your own initiatives, or you are volunteering with another non-profit, so follow certain job descriptions, understand what is the goal, and I would say start in a very small way. We cannot change the whole world in one instance, but we can take one thing at a time and keep on increasing the intensity and work on it. So these are certain challenges, and the solution that we simply say is learn, act, and engage. With this simple strategy, we will be able to leave a lot of impact in this world. With this, I would like to also urge all of you that you can complete the course which is hosted on our Health Volunteers website, and the campaign which is going on, Youth Against TB. Simply go to the website and you will find Tuberculosis 101, a volunteer toolkit course. When you will be able to complete, at least your learning part would be covered through this course, and you can take pledge in this program and showcase your solidarity. Now I will stop here. There is one challenge among young people, that when we go out and volunteer, how we can, safeguard ourselves. There is always a
Right.
risk of getting TB.
Correct.
So
Right. Great.
how we can take care of that? Yeah.
Fine. So one thing that we need to understand is basically if we are living in a high burden setting, that itself is a risk. That's what I'm saying. So that itself is a risk actually, right? So our objective is to reduce that risk in the society, the burden of TB in the society that we actually try to live. I'll just tell a simple example. Uh, in a country like India or even in Nepal, uh, more than one third of the population is infected with tuberculosis, right? I'm using the word very carefully. I'll try to explain what that actually means. More than one third of the population is infected with tuberculosis. I'm repeating it again. So that means in Indian population, there are almost 40 crore people infected with tuberculosis. I am sure that I might be a person who is infected with tuberculosis because I used to get exposed very, very openly. Infection means that bacilli has entered my body but I am absolutely normal. I have no symptoms. I have no disease at all, but I have a dormant bacilli lying within my body. When my immunity drops down, then only I may develop a TB disease that can happen anytime during my lifetime, right? When my immunity drops down. So that means when I get a diabetes or when I am smoking too much, when I am engaged in chronic alcohol abuse, my immunity will drop down. Or if I am undernourished, my immunity may drop down and I may flare up, get a disease, full blown disease actually. The dormant sleeping bacilli will become active at that point in time. Now, the chance of developing, I told you that one third of the population is infected with the TB. Out of that, 5% will develop TB disease anytime during their lifetime. I'm again saying, if 100 people are infected with TB, 5 will develop a TB disease anytime during their lifetime. This is something that we really need to understand as the youth channel, right? This chance is there. Anybody living in this high burden setting, this chance is there with us. That's what I mentioned. Diagnosed people with TB are not the problem for us at all, because once they initiate them on treatment, they are on treatment. Once the moment we start them, put them on treatment, their infectivity will generally come down. It is the undiagnosed people. That's what I told. If you are traveling in a public transport system, if you are going to a movie house, if you are going to a public place, if you are visiting a mall, especially indoor areas, you will all have this the same risk that we are actually having. While we are volunteering, if you are volunteering, not volunteering, the risk is same for you. Now, specific precautions can be taken. That's very clear. So if we know that, generally what we need to happen, again, I am saying, all these precautions are essentially required in the general community, not people with TB generally, right? So that's what I'm saying. Diagnosed TB, people with TB are not the people who are spreading the TB. It's about the people who are undiagnosed, especially with respiratory symptoms. They are the people who are spreading the TB. So one of the key campaign that can happen is something like a cover cough campaign. Anybody coughing, anybody spitting, anybody sneezing, there are some cough etiquettes that we need to follow. I'm talking about, if a person is coughing, either they need to cover their cough. Right? Covering of the cough can happen either using a handkerchief or using a mask, or even we can even cough to the shawl or the sari or even the upper forearm, wherever it is. Right? Cover cough campaign is something which generally we need to do. It will help in reducing the transmission of not only TB but all airborne diseases in the community, starting from COVID, H1N1, pneumonia, chickenpox, or whatever it is. So all these airborne diseases transmission will come down if everybody in the community starts cover cough campaign. Whenever we are coughing, cover your cough. This is something which we can actually try and do. Fine. That's for the general community. If you are interacting with a person with TB, or if you think that the person is having TB, what we really need to do is try to speak them in well ventilated area. Try to speak them in well ventilated area means, if you're speaking in natural air, just outside the home or in any well ventilated area where there are cross ventilations, air is coming from one direction and air is going through other directions, it's a room with good windows, good doors and all, your risk is absolutely nil. That's what I'm trying to say. If you are talking to a person affected with TB in a well ventilated area, your risk is absolutely nil because of the dilution principles. Try to avoid getting into indoor closed spaces where there are no ventilations, where there are no air circulations, and just try to avoid that. So if you're visiting a person with TB, again, if he's on treatment, I already mentioned about the chance of infections are much less. But again, always try to do in this way. Try to talk to them in a well ventilated area. That is something which we can try. Call them out of the house and talk with them. Call them in the sit outs and talk there. Don't try to get into, say, what we call as the uh, uh, closed ventilated. There are no air circulation. That kind of areas generally we can avoid. That's one step. The second step is actually the persons with respiratory symptoms, whether they are having TB or whether they are not having TB, whatever it is. The people with respiratory symptoms, if they are wearing a mask, that will actually bring down the transmission like anything. Anybody with respiratory symptoms, if they're having respiratory symptoms, offer them a mask. Ask them to wear that. Once that person is wearing a mask, then we don't need to worry too much about that. Instead of mask, if handkerchiefs are available, that's fine. Or saris are available, that's fine. Or shawls are available, that's fine. I'm generally saying these are the two generic principles that we need to keep in mind while we are dealing with any respiratory infections generally. As such, if you are trying to, again, I mentioned, if you are trying to run away from this thing, you will never reach anywhere because you share the same air spaces with anybody in these high burden settings. So our responsibility is basically understand the risk and then try and go and do your duty well. I hope I am clear. If you need more clarifications, just ask me.
Yeah, there is one more question from Suren Kumar. He wanted to know more about latent TB follow-up testing after 1 year of treatment.
Yeah. Thanks. So latent TB or is a form of dormant form of TB, right? I already mentioned about the TB infection wala piece. That means whenever when I am inhaling a bacilli, so person with TB coughs, I inhale a bacilli. The bacilli can get into my body, and there is a chance that it can remain in my body in a dormant stage. Dormant stage means the bacilli is sleeping. It can sleep there. Nothing will happen to me. It is just remaining sleeping there. My immune system has contained it really well. So I am just remaining sleeping. This is what is going to happen. The bacilli will remain sleep or in a dormant stage. That's called latent TB disease. That's what I mentioned. That's called TB infection, basically. That's what I mentioned. 30% of the entire population will have this condition. They have the dormant bacilli inside their body, or they all have what is known as a TB infection generally, right? They will have this condition. Absolutely healthy they will be. There won't be any issues. There won't be any symptoms. There won't be any signs in the X-ray. They won't be transmitting disease also. It's like an absolutely healthy individual. That's what I mentioned again. 30% of the country's population. They are having this dormant bacilli in their body or latent TB condition or a TB infection, whatever it is. To detect a TB infection, yes, there are so many tests available, like Manto test or the quantiferon gold or IGRA blood test. These kind of things are available. But again, the chance of developing into active forms of TB are much less unless your immune systems are functioning much less. That's what I mean. Unless you have a problem with your immunity generally. So you don't need to worry too much about that. Only among based on the criteria of TB preventive treatment available in the country, if you are a close contact of a person with TB, or if you have any other condition, say for example, if you are a renal transplant patient, or if you are having other immunocompromised conditions, then if you have a TB infection, there are TB preventive therapies available. TB preventive therapies are basically a small kinds of drugs, anti-TB drugs that can actually kill even the dormant bacilli to help you preventing you developing the disease. So these are called TB preventive therapies. These kind of preventive therapies are also available, but again, it's not being meant to be taken by everybody and everybody in the community. It's only for selected group of people. For example, depends on the country's policy. Contacts or children less than 5 years, or people who are at having this immunity problems with the immunity. So these are the kind of people who can undergo a TB infection testing. And if infection is present, they can take a preventive therapy generally. This is what my response is.
Thank you, Dr. Rakesh. And I guess at this moment now, we can go ahead and start the closing. If anyone of you still have any questions, feel free to ask. The last call to action that I would like to give all of us is that whoever you are, wherever you are as a young person working, make sure that for this for this World TB Day, at least do some digital advocacy, promote and spread awareness about tuberculosis. And even if it is about sharing symptoms of TB and how they can, other people can get TB treatment, diagnosis, or even just breaking the taboo or breaking the stigma around tuberculosis. Whatever you can do, just do. At least start from the digital aspect. And if you have some experience, if you have more than baseline knowledge, then go ahead and volunteer for TB because the world needs us, especially the young people. Now, I would like to invite Sadiksha from NEMAT Global to give us the vote of thanks and help us in closing this session.
Thank you so much, Rishiji. Hello, everyone. Hello, Dr. Rakesh. It's pleasure to see you again after such a long time, and I'm very happy that we have a good harmony of Nepal and India here in this session. It's very lovely to see the commitment of young people from both the countries, and yeah, so it's always a pleasure to learn about TV from Rakesh sir and Rishiji. Also, you have stressed on how young people can really engage in the community and about stigma and everything. So overall the session was very fruitful for me, and I hope everyone got to learn so much as well. So I also wanted to add some question to Rakesh sir if he still has some time. So my concern was why are our countries not very much focusing on finding the infected people in the community, and what can we do as youth to advocate for those kind of things. Yeah,
Yeah,
that's my question.
that's what. Yeah, so every country should actually focus on finding the people with TB because uh, that is the intervention, key intervention that need to happen. I mentioned that, right? So to bring down the incidence of TB in a community or to prevent the TB transmission in the community, we need to find all people with TB early and treat them. This is what is being need to happen. So earlier and all, what used to happen is people will wait for developing TB symptoms. Then they may go for say, you know what people generally do when they develop cough, right? So they may go to some informal providers or they may go to a chemist shop, try to get some medicines. Then even if it's not settling, then they may try to go for a provider. You understand? So generally there will be huge delay in we seeking healthcare generally, right? That same thing happens for what if I develop cough also, what I will generally also try to do is say, I will wait for some time, then I will go get a cough syrup, then I will go and meet some informal providers. Then by the time I reach the system, it will be uh, too late that or during all these times I'm transmitting the disease. That's what is being generally happen. So what we should do to avoid this delay? One, obviously, yes, awareness is something which we can actually generate as a youth. Saying anybody with any of these symptoms, like you have cough, fever, weight loss, or blood in sputum, just go and get a test and ensure that. Why are we doing the test? The test is not to know whether you have TB, but just the test is to confirm that you don't have TB. The communications really matters when we talk to people. The moment we say that you go and test, you might have TB, they will be very scared and they will not test also because of the prevalent stigma available in the community. The moment you say that you go get a test and confirm that it is not TB, people will be happy to do that generally, right? So that's what, as a youth, that we can actually try and do in this way: raise the awareness in the community, support the people. Other thing is basically what the system is trying to do is do active case finding. Active case finding is rather than waiting for the people with symptoms to come to the hospitals, the system will go to the houses, doors. Somebody will go and ask them, right? As a volunteers, we can say if we adopt an area, we can go and ask everybody, do anybody in this household has these symptoms? If you have symptoms, just uh, give your sputum into this hospital and confirm that you don't have TB. This will actually help in, this is called active case finding. We are active. As a youth volunteers, we are also active, right? This will help in reducing the delay. If you wait for that person to come to the facility, they may take another 1 month or 2 months to reach the facility. But the moment we are going to the community and asking, that is basically, it can actually prevent delays. The same kind of case finding can happen in schools, colleges, elderly homes, maybe in orphanages, in all congregated settings, hostels, all these things can actually happen. This will actually help in preventing, diagnosing the TB cases early. All governments are doing in that way. We just need to tie up with the government for all the necessary tests and all, and support them in getting some of these early case finding activities. This is what we generally need to do. Or think of innovative ways. Youths are very innovative people. Like think of that. Anybody coming to a chemist shop with for cough syrup, offer them a TB test. How can you do that? So you prepare your innovative ways, methods, and all sort of stuff. Because anybody with TB symptoms may come to a chemist shop, right? So look at what is happening in your community. Then you just need to go and sensitize the chemists, few chemists, 10, 15 people. You sensitize them. You coordinate with the government, get them the sputum cups there. Anybody, you give the cough syrup, but get the sputum sample also. Get it transported, get it tested. If there is TB, they can treat. You are saving life, not only that person's life, not only that family, but the people, the future people who can actually develop disease. You are actually trying to save them. This is what my answer is. Thank you so much.
Thank you so much, sir. And with that, I would like to close my remarks. Thank you so much, Rishi, for coordinating this event. Thank you so much, everyone, for joining us.